Namaste, welcome to Ayur Bodha. Myself, Dr. Mahesh Savalagimath. Today we are going to discuss something about selection of formulations, how to understand formulations. Actually, recently we were discussing this topic with our PG students, so I thought let us make a video on that. Maybe similar kind of issues may be there with many of you. So in that direction, we'll be discussing this in this video. So what it is like multiple formulations and single indication or similar indications will be there, but formulations will be multiple. Now, how to choose between them? How to select them correctly? Many times, what happens now? We keep on prescribing medicines based on the indication, like one disease is there and set of medicines are there, so we go on prescribing and we do not get similar kind of results in all the patients, all the conditions, because they are not the right prescriptions. Like there are 10 drugs and any four, any two we can prescribe in that disease. No, it's not like that. Whichever is available, let us prescribe that. No, it's not like that. They all have their own reasons behind selecting those formulations. So thought like we'll discuss on this. But today we're going to discuss about these four formulations. Actually, these were discussed on that day, Arogyavardhini, right? We are considering Pitta Hara drugs, right? Acting on Pitta Hara, particularly Pitta Hara drugs. So, Arogyavardhini Rasa, Avipatthi Choorna and Patolamooladi Kashaya. Arogyavardhini one set, Patolamooladi and Avipatthi is another set, and third one is Patolakaturohinyadi Kashaya, right? All the four are used in treating as I am a dermatologist, Ayurveda dermatologist, so they are used abundantly or very frequently in managing skin disease, particularly pitta dominant conditions, right? So we'll discuss them. But there is a disclaimer. These, whatever I'm going to say now, these are 100% my own views or my way of understanding. So at the end, you only tell me whether it is okay, right? Or if you want to suggest anything, please suggest in the comments, right? So we'll discuss. Now, first very important thing is we need to understand the conditions. Right? Rogamado Parikshe Tato Anantara Beshajam. First, we need to examine the disease, then we need to examine the medicines, and then we can select the right medicines and prescribe. Now, consider the pitta. Like, there, as per my understanding, there are three conditions or stages of pitta as anatomically in the body pitta. One is pitta is Ghana and Alpa, right? Alpha quantities, it's very less in Kosta and it is Ghana in the Shaka or in Yakrit, you can consider like it has not yet come to the Kosta. So that is one. So what is to be done there? There we need to increase that Pitta and then bring it to the Kosta so that elimination can become easy, right? If Pitta is not there in the Kosta, if we give the drugs that are used for eliminating Pitta, then we do not get the actual result. Sometimes it may end up just increasing Koshtagata Vata, right? That is one. Pitta is Ghana, right? And it is Alpa in the Kosta. It may be there in Shaka, but it is very less in the Kosta. And we need to bring that to the Kosta. That is one condition. Second one is Pitta is Drava. Drava Pitta, whether it is there in Drava, in Kosta, as well as in Shaka. So there is one condition. There we need to eliminate it. Third one is it's not that Ghana, not that Drava. So in that we need drugs which are going to secrete, which are going to increase the Dravata and simultaneously eliminate, right? These are the three conditions as per my understanding of Pitta. Ghana and Alpa Pitta, completely Drava Pitta, whether in Kosta or Shaka. And third one is Nati Drava, Nati Ghana, right? These are the thing, which is Nati Ghana, Nati Drava means partially it is there in Shaka and partially in the Kosta, right? So what type of actions are required? One is secrete and eliminate. When Pitta is Ghana, hard, solid, it should be secreted. It should be made into liquid and then it should be brought to the Kosta and then it should be eliminated. Secrete and eliminate. Second one is Drava Pitta is already there. Just eliminate it. Just eliminate. Eliminate it from the Kosta. The third one is partially we need to secrete, means the drug should secrete it partially and then eliminate so that it eases the elimination, right? So these are the actions required as per my understanding, right? These are the actions required. Now consider the conditions. Like for example, secrete and eliminate. Arogyavardhini. Where we most commonly prescribed Arogyavardhini is in Shakashita Kamla. In Shakashita Kamla, Arogyavardhini is very abundantly. Skin disease, it is prescribed. Every skin disease is prescribed. But it should not be, not necessarily in all skin diseases. But when you look into Kamala, Shakashita Kamla, or Baddhapada Kamala, or obstructive jaundice and all, there Arogyavardhini is the best one. Because what Arogyavardhini does, Arogyavardhini makes the body secrete pitta. It makes the body secrete the pitta, and then it brings to the koshta, and then it eliminates. It makes the body to secrete the pitta, brings that to the koshta, and then eliminates. Right? Arogyavardhini is Deepana also. Right? Deepana, not Pachana. Deepana is very good because for Agni to be Dipta, what is to be done? Two things are important. The Agni should be Pitta, Pachaka Pitta should be Ghana. Takta Drautam Pakadi Karmana Anala Shabdidam Khatina. Ruksha Pitta should be there. So one thing is in Koshta Pitta should be there. In Kamala, what is there? Agnimande, severe Agnimande, Aruchi Agnimande and all will be there. So why? Because in Koshta Pitta itself is not coming. If Pitta is coming, then that will get dried, means that will become Ruksha, then it will get converted into Agni. Now in Kamala, Pitta itself is not coming to the Koshta. So from where Agni will come? So there, in such conditions, what happens? Arogyavardhini is one of the best formulation which makes the body to secrete Pitta. Then that secreted Pitta, Drava Pitta, so that comes to the Koshta. Then with the help of, if it is more Drava, then it will be eliminated by Arogyavardhini only. If little Pitta comes to the Koshta, then with the Samanavata, the Pitta becomes Ruksha and Agni gets Dipta. So that is how secrete and then eliminate. Next is just eliminate. For example, in Shita Pitta. Shita Pitta, we do not use Patolakaturohinyadi, we do not use Arogyavardhini. If we use Arogyavardhini or Patolakaturohinyadi, we may not get that much, anticipated result. Acha result nahi aayenge. Instead, if we use Avipatthi Choorna or Patolamooladi Choorna, we get very good results. Why? Because they are just eliminating. They are just eliminating. In Shita Pitta, there may be Koshtagata increased Drava Pitta, right? Or even if less Drava Pitta is there, that also if it get eliminated, and if that Pitta becomes normal, the Koshtagata Pitta, if that becomes normal, others will become normal and itching will be reduced. That Shita Pitta will be subsided. So Avipatthi and Patolamooladi, what they do, they usually do not, Avipatthi Choorna and Patolamooladi, they do not secrete the Pitta. They just eliminate the Pitta. Right? They just eliminate the Pitta. Right? Patolakaturohinyadi, it does both partially. Partially secretes, partially it secretes and eliminates also. For example, in case of Vichachika and all, where there is Nadi, what will be there? Sa Kapha Pitta. Though we say that Kapha Pradhana Vichachika. But Kapha in that Vichachika, how it is there? Vichachika. Kandu Pidaka Shava, Bahusrava Vichachika. Bahusrava. Srava is there. Why that Srava is there? Pitta is melting kapha, so that is why Srava is coming. So still Drava is there, but still we need to increase the Dravata and then it can be eliminated. So Patolakaturohinyadi partially secretes and then eliminates. Understood? Clear? So there will be conditions like in jaundice or Kamala, Shakashita Kamala. We need drugs which secrete Pitta and then eliminate. In Shita Pitta and other conditions where we need drugs which are going to eliminate. The third, like Vichachika and all, where I told you partially secrete and then eliminate. Patolakaturohinyadi does that one. Now consider that Shita Pitta. If you get doubt, like how not necessary that Drava Pitta should be there in Shita Pitta, not necessary, but still there will be little Drava Pitta, right? Drava Pitta will be there. If we want to use, like there are two options. We can go with, if Ruksha Pitta is there in Koshta, then Patolamooladi is not necessary. We can go with Pitta Grita. Pitta Shamana Grita. Because Ati Ruksha Pitta is there. So you would give that one, that Koshtagata Pitta will be maintained and Shakagata Pitta gets subsided. If Drava Pitta is there already in the Koshta also, then Shita Pitta is there. We give Patolamooladi or Avipatthi, which eliminate that. Now what happens by eliminating Koshtagata Pitta? Pachika Pitta, you have to read today, right? Pachika Pitta, once again you read. Pittam Panchatmakam. Right? That quotation. Last two lines I have taken for discussion. Tatrastameva Pittanam Sheshanam api Anugraham. Tatrastameva Pittanam Sheshanam api Anugraham Karoti Baladhanena Pachakam nama tatsmritam. So what it says, tatrastameva pitta means the one pitta, Pachaka pitta, which is there in Koshta, that Sheshanamapi pittana, remaining four pittas, Anugraham, it nourishes that, it neutralizes that, or it controls them. Karoti baladhanina, gives them bala. Whether that bala is good or bad is dependent on what. Like, when we eat more pitta karatrave, so koshta, shakagata pitta gets prakupita and disease. Means there it is giving negative bala. Right? It's giving negative bala. Here, if the koshtagata pachaka pitta becomes normal, prakrita, then it gives good bala to the shakagata pitta, or the other pittas, other remaining four pittas, and disease will be subsided. Hope it is clear. And once again, I want to make sure that this is completely 100% my way of understanding while prescribing medicines. If you want to, just as part of video, just if you want to practice Ayurveda dermatology and improve outcome or improve your dermatological practice, then I have a 50 hours online course. 30 hours is on complete management of psoriasis management mastery in Ayurveda, and 20 hours is dermatological manifestations due to Visha, which we call as toxical dermatology. That deals with contact dermatitis, allergic skin diseases, drug-induced skin diseases, occupational diseases, bites and stings induced skin diseases, like that, and even utilization of keto chikitsa in the dermatological manifestations. Right? Whole course cost is more than 10,000, but as an offer, it is, you can join the course at just 7,000 rupees. You can visit our website www.ayurvedicskills.com, and even I will give you the link in the description. If you are staying outside India, then same course is at $100, $100 US. It's not that big. So hope you understood the topic what I discussed, and if you have any doubts and suggestions, whether you agree with my opinion or not, please write them in the comments. And if you want any particular video, please write that also in comment. Thank you for watching. Take care. Namaste.